Hello and welcome to another edition of Doc Talk, our information and educational conversation series. It gives me great pleasure in welcoming today Dr. Susan Brown, a natural bone health expert, to our show. So welcome, Susan. Thank you for
Thank
joining
you,
us.
Jane. Nice to be with you.
Absolutely. So Susan is not only a bone expert, she is a medical anthropologist and a New York State Certified Clinical Nutritionist, has more than 40 years of experience in clinical nutrition and bone health research, and educates the professionals as well as the lay public. So we're going to pick your brain today, Susan, about some things. So thank you again for joining us. So first off, I'd like to ask you, what got you into bone health?
Well, Jayashree, I was an anthropologist working in South America and Central America, and my grandmother actually developed. She actually fractured her hip at the age of 101, and she subsequently died 1 year later. She went to bed when she fractured. The family, she said, I've taken care of my boys for 100 years, they can take care of me. And so she was very sound of mind. She and 1 year later died, and I always thought how long she might have lived if she hadn't had that fracture. Now, my grandmother had both osteoporosis and rickets, which is a very interesting story for a country person here in the US. And about that same time, I developed receding gums. And I was smart enough to realize that that's an early sign of bone loss. So I said, let me look more around the world and see, is this common that older people and that people fracture so much? Or is it something just related to certain societies? So that was the story of how I got interested in my grandmother and my own concern.
So neat, because, there are so many other conditions. The heart condition gets the top notch attention, right. And then there's other things that gain a lot of traction. Then bone health, of course, has been gaining a lot of traction now, but it's interesting. So many years ago that wasn't the case. I'm glad you got into it. And now you're called a natural bone health expert, so give us a little idea about what it may be different. I mean, how do you approach bone health differently than maybe, a regular?
Sure. Well, my interest has always been in first looking and see, is this really a phenomenon that happens all over the world, or is it a culturally specific phenomena? And of course, we come to see that Western cultures have much more bone weakening than other cultures. In fact, there's 100 times fracture rate difference around the world. So I looked at this data. The first book, Better Bones, Better Body, looked cross-culturally and said, is this really a problem every place? And it really wasn't a problem every place. And so I began to look, well, what's the causes of bone weakening in this culture? If you say, well, perhaps my calculation is that a third of all women will have some sort of meaningful fracture. It could be simply a wrist fracture, but still it'll be a meaningful, painful fracture. And so I thought, why in the world does this happen so much here? So we looked for the causes of bone weakening.
Okay.
Just like a functional medicine doctor would today, to try to find out what's going on with any particular health problem. And of course, we came up with, when you look for causes, you come up with a lot of variety, many factors, and certainly diet, exercise, lifestyle.
Right. So what would you think would be the top causes from your research? What did you find?
Well, one thing you definitely notice is that there is quite individual considerations. So you couldn't say for everyone the top cause is this or that, but what we can certainly say is that nutrition and mineral depletion of the human body is a really very important thing. Bones are very dependent on a diet that's very abundant in minerals. And this is kind of the ancestral diet that we consume: lots of magnesium, lots of potassium, a reasonable amount of calcium, adequate iron, manganese, zinc. And we began to see in the research that the people who were fracturing had deficiencies or low levels of these particular minerals, much less antioxidants. We're beginning to see today that antioxidant deficit is extremely important. And it makes sense because osteoporosis is an inflammatory disorder. And like other inflammatory disorders, it suggests that we have a deficit of antioxidants to be able to quiet down that inflammation. And of course, as our colleague, Dr. Jaffe, has pointed out, we find that today we live in a state of repair deficit. We do not have the nutrients or the biochemical environment or the milieu as a whole to successfully repair the body. So there's, interestingly, Canadians recently have calculated 125 secondary causes of osteoporosis.
Oh my gosh.
So there are many causes that we look at. We certainly look at the exercise, also extremely important. I joke that pretty soon the most popular profession is going to be physical therapy because we are getting so inactive. If you think about it, you walk into your room and you say, Siri, turn on the light. You don't even have to turn on a light anymore.
I know.
And every day this is becoming more and more pronounced, our lack of physical activity. And so that's
a huge one too. I'm going to come back to the activity portion in a little bit, but we touched upon minerals. And that's key because, there's always been talk about calcium, and the bone. So now, of course, things have turned a little bit on the other side and people are wary of calcium now so that it doesn't cause extra calcification elsewhere in the body, etc. But, still a few years ago, calcium was the main mineral. We do know, and you also talk about it, that there's so many other minerals. So how do you, what do you tell folks? What do you tell your patients? Would they get all of these minerals in the best way?
Well, the first thing, what we help people to understand, and what I understood through so many years researching bone health, of course, is that every nutrient is important to bone health. And specifically, I've identified 20 key bone building nutrients that are absolutely essential. So we encourage people to look at all of these nutrients and see how they are important to bone health and how they interact with one another. And so we teach people about the 20 key bone building nutrients. We do mention that it's been kind of a shame that due to commercial forces, I believe mainly, so much attention was put on calcium because it really kept us from looking at all the other nutrients, the nutrients that are very important. For example, I believe certainly vitamin D is more important than calcium. Certainly magnesium, I believe, is more important than calcium.
Magnesium, yep, absolutely.
And certainly these antioxidants, like you could argue that ascorbate is as important as calcium for bone health. So we teach people about the 20 key bone building nutrients. And then how do we get these nutrients? Well, of course, we'd love to get them in the diet. And so this is where the story of the alkaline diet comes along. Awesome. And we can talk in a second just about what an alkaline diet is.
Yes, absolutely. I'd love to know from you. We talk, and I work with Dr. Russell Jaffe, and we talk about the alkalizing diet, and not just the diet, but the lifestyle. So I'd like to know, how you've been able to incorporate this alkaline kind of diet in your.
Well, sure. Let's talk about that because the diet is one important step. I will say there's 6 components to the Better Bones, Better Body program. And the diet is an important one, but generally people need, in this culture with the toxic burden and our lifestyle, we definitely need additional support from nutrients. I find it very difficult to get everything from diet alone, but diet is where we start. And so an alkaline diet is like so many other life-supporting diets, high in whole foods, natural foods, unprocessed foods, organic foods if possible, of very high mineral content. The special twist to the alkaline diet is it's aimed at creating pH balance, a balance of acid and bases within the body. And so we look for certain high mineral foods, for example, foods high in magnesium, foods high in potassium, foods high in zinc. All these foods really help to alkalize the chemistry. So it's a diet aimed towards biochemical balance. And it always is a whole foods diet, but it has a particular end, keeping that pH in balance.
So the pH. So I'd like to, a lot of us do, you and I know what, how
Yeah.
important pH is and how that affects just, you were talking about inflammation and repair and bone. That's one aspect. You're also talking about, the minerals and such. So
Right.
the alkalizing diet is geared towards pH balance, right? So tell us a
Yes.
little bit about pH for those folks who don't know about it. How
Yeah.
would you
Someone might
explain
say,
it?
well, why? Yeah, that's reasonable. So why is pH balance so
Right,
important that you're going to develop a diet around
right,
that?
right.
And that is because every fluid in the universe, or at least in the known universe, has a particular pH, and that has to do, in technical terms, with the balance of hydrogen the amount of free hydrogen ions, which is acidity, the amount of acidity compared to the amount of base. And this
Base,
provides a
yeah.
sort of chemical environment for all these chemical reactions to occur. Billions of chemical reactions if occur every second in every single cell, it appears, and they need a particular chemical environment. And so when the pH is even slightly off, if it gets very far off, there's no problem, we're dead. But if it's slightly off and we're still alive, what it does is it affects the functioning of the cells in a profound way. Even a tiny shift in pH towards acidity can cause really significant changes. For
Right.
example, ATP energy production is greatly decreased. So you can't produce as much energy in the body.
So you get
Protein,
fatigued. Wow. So you get fatigued, right? Yep.
protein synthesis is hampered so that we don't so effectively produce proteins. The body is hampered in its ability to detoxify, which is another important thing.
Well, that's
And
important. Yeah.
many enzymes are really pH dependent, that they need a particular environment to kick into action. And so there now are vast studies, and interestingly enough, studies all over the world that are looking at the alkaline diet, and they compare it. They call the alkaline diet like a basic whole foods, high mineral diet. They compare this to the Western diet, and they
Right.
show a amazing range of disorders, things, not only bone health and things like joint health and digestive disorders,
Right.
but a whole metabolic
Interesting.
syndrome, kidney disease, many disorders related to pH balance. It seems to be one
Interesting.
of the major platforms for establishing healthy biochemical functioning. We need to have the pH in line, and the diet will do it if we got back to eating patterns of our ancestors.
Right. So eating patterns, so going back to the basics, that's how I see it sometimes. So give us an example of what an alkaline type of food would be, or alkalizing. So we're not talking about the food itself, but the effect it has on the body, correct? That's what we're talking about.
Yeah. We're talking on the metabolic effect.
Yes.
Metabolic effect of food. So it's not like how the food tastes or how it looks. It's when we consume the food and the body processes it, what's left over. Are there compounds that actually can buffer acids like bicarbonate, or citrates, or are they compounds that actually add acidity to the body, like free hydrogen? So we may eat something like a lemon and say, this tastes very acid.
Right.
But it doesn't have an acidic effect when it's metabolized. It actually is metabolized into bicarbonate and water. Citric acid is metabolized into bicarbonate, which is the major buffering compound that the body produces and the body uses. So yeah, it's the metabolic effect of foods.
Right.
And in fact, Dr. Jaffe has done a nice job calculating the metabolic effect of different foods. Other researchers have set up their calculations, Linda Frassetto, Thomas Remmer, but they're pretty similar. Basically, we know that the fruits, vegetables, nuts, and seeds, most of these alkalize, where protein always is acid forming, just like we produce our own little acid rain within us when we consume too much acid. But we're always careful to say it's just excess acid that causes the protein, that causes the acidity. Then things like alcohol, of course, are very acid inducing. Sugar is very acid inducing, a whole bunch of preservatives and food additives.
So that's kind of like a typical Western diet. You see, it's got high animal protein, it's got a lot of sugar, high fat, things like that, which is going to be more acidifying, right? So There you go.
Well, and the key to the Western diet really is processed foods.
Yeah.
I mean, about 70-80% of our diet is processed. And with the processing, you lose a lot of minerals. And that's presuming that the minerals were in the food before. And unfortunately, we're seeing that that's not true.
That's not true, yeah.
Yes, there's a wonderful movement afoot today to recover the soils. In fact, one of my spiritual teachers, Sadhguru, has a whole worldwide campaign for protecting the soils. And, and there's many other people working on this to establish agriculture as something that's life-supporting for the soil, for the bacteria, and eventually will also be life-supporting for humans. So we have to change agriculture around.
I mean, we're talking about foods, what we put in, but then if the foods that we put in don't have the nutrients that we hope they would have, then what's the point, right? So yeah, you bring up a really good point, starting from the agricultural aspect of it. So when you talk about pH, I want to just change it a little bit and say, now I know that the foods and the lifestyle, you want to make sure that you're alkalinizing enough so that you have this pH balance. Now, is there a way that you can measure how you're doing? How is this pH balance? How are you on track? Are you not on track? What do you say? How do you measure that?
Yeah, you'd love to be able to measure like the pH in the blood or the pH in extracellular fluid, but you simply can't do it. It's not practical. And so Dr. Jaffe actually and others have been very instrumental in developing a very simple test looking at first morning urine. It's your kidneys that basically have to process all those acids that remain over in our body, and over the night when they tend to process those acids, and we can see an equilibration between the bladder and the urethra on that and the larger tissues. So it has been established that first morning urine, before eating or drinking anything, that will give us an approximation of tissue pH. And so we suggest people measure the first morning urine. You like to see 6.5 to 7.5. And now many researchers around the world are also agreeing with this, that gives us a pretty good idea of how many buffering mineral compounds we've been able to have and how much excess acid we still are releasing. So we look at first morning urine.
Okay, so that's a great tool for, it's a great at-home tool, right? It's not, you don't need to go to the lab to do that. It's something that you could do right at the comfort of your home and get a good clinical insight into how the lifestyles work. And now, foods affect the pH, obviously, but are there any other things that could, sway this pH from going, haywire?
It's anyone who works with clients and have them keep their pH and watch what happens over time. You come up with a person who says, look, I've eaten everything perfectly. I didn't change anything. I used all my supplements, but still I had an acid tilt. And so we know that certain things like stress, like cortisol, when you have a big bout of stress, cortisol is very acid forming. And in fact, it produces acids on its own right in the body. So we know that can be a really important thing. We know that certain medications are certainly a problem. Perhaps even extremely over exercising, because then you produce a lot of lactic acid that can produce acid in the body if you don't have the buffering compounds. And one of the biggest frontiers in bone health, which we haven't looked at yet as far as pH, but is the emotional aspect of worry. Worry and fear directly damages bone. And so it'll be, now the scientists know that. They know exactly what happens when we sense danger. Bone sacrifices itself, even before the adrenals kick into action, to send osteocalcin to general circulation to quiet down the parasympathetic nervous system so you can remain full tilt, stressed out, sympathetic state, because there's a sense that it was a severe emergency. So it'll be really fun to see. I totally believe that we're going to find that a stress response in more ways than we expected, more than just cortisol, is actually damaging to pH balance and has a detrimental effect on cellular functioning.
Yeah. So you've mentioned cortisol, and with that comes sleep as well. So, stress and sleep, and we don't have the restorative sleep.
Right.
You don't have the good cortisol rhythm that you need in the day. So, all of this kind of puts in. So then, it is much more than just the foods. It is the lifestyle. And so you mentioned yoga, that you do yoga a lot. And then that's kind of now segueing into the activity part of our conversation, where, you got to balance or do the activity, I guess, which is not only physical, but mentally appealing and emotionally restorative as well. Correct. So what are your thoughts on the activity during this time?
But something, Jayashree, you're from India.
Yeah.
And what researchers are saying, that this alkaline state is like a sattvic state. It's a state of balance. It's a state of harmony within the body. And the same thing pertains to our lifestyle. If we're at ease with the world, if we're gracious, if we're kind, if we respond with kindness, that's alkaline, that's sattvic, that's balancing, as opposed to anger or agitation or fear. Right. So we want to develop that road of balance. I think it's really interesting. And if you want about exercise, you might say, I think you were asking me about exercise.
Yeah. Mm-hmm.
So we got two interesting things going on here. On the one hand, you have people like Belinda Beck, and on our website, betterbones.com, we just did an interview with Belinda Beck, a doctor in Australia, who has shown that you can rebuild bone, you can reverse osteoporosis with strength training. So she has these older women doing 5 or 6 significant weightlifting exercises under very careful supervision. And these women are building bone. So you see, if you load the bone, it's going to stimulate the bone to grow strong. It's like the body saying, hey, if you don't strengthen, you're going to break. There's something bad coming if you don't strengthen. So it's like, in a sense, threatening the body to then say, I really need to get strong. And that's very effective, but not for everyone, because first place, you have to have very good guidance and good people working with you so you don't get injured. But then also many people don't like it. And the other part.
So do you recommend strength training in your program?
Well, like I'm saying to you, it's very individualized. I really love strength training. Many of my clients love strength training, but on the other hand, strength training produces cortisol. Strength training is a stress-inducing thing. So there's people that can be fine with that. They can come back into balance. Then on the other side of it, you have this sattvic practice of yoga and Tai Chi and Qigong. And the Chinese are recently saying these mind-body techniques, what they call mind-body techniques, of exercise, are as effective as this strength training. And so I've always thought that was really true. So there's certain people that are maybe a little bit less hardy. You go down the street, you see some people are really strong, and other people are a little bit weak. They're a little more delicate. So those people, it's probably better to do the Tai Chi, the Qigong, the Pilates.
Right. Okay.
So there's many avenues to load the bone, to tell the bone, look, get strong for me. I want to be strong. So a great lot of variety.
And again, it's a matter of balance. So it's everything.
An individual situation, we must see what resonates with the person, what's good for their body type and their physiology, and what they want to do. We always say the Better Bones, Better Body program is really about building a better body, staying stronger longer. And so each individual has a path to that. The alkaline diet is always an essential part of the path to staying stronger longer. The foundation, it's one of the most important. Getting back to the diets of our ancestors. As an anthropologist, I look back at what they're saying that they presumed our ancestors ate, thousands of years ago. Well, it was what did we have? We had the plants and the seeds and the nuts and the bark. That's all we had to eat.
That's all we had.
Maybe a little honey, and it was very high, maybe 5 or 6 times the minerals of what we're getting today. And so we need to try to return to what I'm calling our ancestral lineage diet. These high diets, high mineral diets of fresh, wholesome foods.
Wonderful. So I will thank you for all of that insight. And I want to just ask you to close out. What would you say would be the top 3 or 4 things, a woman should do in their 40s and 50s, or should they start looking at things even earlier to make sure or to ensure that their bone ages in the right way?
Well, we could totally do away with the osteoporosis crisis if we took better care of our children. Obviously, if you build a little bit of bone mass in kids, you can delay the incidence of fracture by 10 years, and most people would be dead before they fracture. So it's very difficult to convince people they should pay attention to children's bone health. Children both grow spontaneously. Naturally, it's a miracle. In fact, I've always thought I should call my book The Bonsai Bone, because it's so natural for bone to grow. What do we have to do that constricts bone so it doesn't flourish? But we know that vitamin D deficiency, the simplest thing worldwide would be to test people for everyone vitamin D. If you give these children vitamin D and nutrients, they will build stronger bones, and they will keep those stronger bones. If you exercise these children, just jumping off a little block, the gym classes, they have shown endless studies that you can build bone density in children. Right. And so the children thing is really great, but we pay attention when we go get a bone density test. The doctor says that. So just know that I think what I would say is, if you can get yourself in a situation where you like being strong, so much of this culture has portrayed women, it's fashionable to be weak, it's fashionable to be kind of silly-headed, that it's fashionable. It's a very good idea to be strong and stay strong for a long time. One of the best advice I could give is go look at some very old people and go to a nursing home and say, is this how you want to end up? Is this how you want to end up?
And I think your anthropology background, kicks in, because you were talking about the cultural aspects of civilizations and people. So again, going back to their traditional foods, traditional cultures, you'll see that they live so much longer and healthier bones, right?
Yes. And to be really practical, we have developed 6 steps. And so certainly the alkaline diet's a really big step. Working on your digestion is terrible. We have to be able to digest these foods, and digestion and the microbiome is undoubtedly the frontier of modern medicine. This is so much controlling our body. We need to do the exercise. We need to really work with stress, and we really need to see what the cause is. The first step in our program is really, if there is excessive bone loss, we always want to find out what is the problem. And we have developed a medical workup, a list of standard tests that doctors should do if they say this is a serious bone problem. And this is what the Surgeon General in 2004 said we should do. First, find out the causes. First, deal with lifestyle and exercise. But now in this culture, the first thing we do is tell a woman to take bone drugs, which is kind of a problem, because we're not seeing it. There's no magic bullet. So at betterbones.com, we have lots of information, and start right out with your alkaline diet. But if you have a severe problem, know that you're probably going to have to get strong nutrition support, and you should look for the causes of that problem. And of course, if you want to kickstart someone, say, just measure your first morning urine. If people say, I think I'm fine, my diet's fine.
Perfect.
We always do that.
Thank you, Susan. That's very enlightening. I mean, it is, the whole body. It's not one aspect that you can, deal with. So the mind and body, it's like Dr. Jaffe says, you are what you eat, drink, think, and do. So it's, you're talking the same things, and so happy that you could join us for this discussion. And you and I go back a long way, and it's been a pleasure to talk to you at this platform, and hopefully soon again. Thank you.
Well, thank you very much. It's been a pleasure talking with you, and may the world turn more sattvic, and we all develop bones to stay stronger longer.
Thank you. Excellent.